Welcome into January 2nd. My name is Janae Hancock here at the live desk, and I'm sure you all have heard as we have jumped into the new year, several illnesses, they are on the rise. And with that being said, I do want to take a look at that file video you just saw here on your screen. I know there are a lot of questions as far as how things are looking here locally and what you can do to not only protect yourself, but also your family members. So I do want to bring in our guest for today. You're taking a look at Dr. Hawkinson with the University of Kansas Health System. And Doctor, I want to thank you so much for joining me for this very timely and important interview. And let's just start off with the first question. What are we seeing here locally in Kansas City?
Yeah, hi. Thank you very much for having me on today. So I think the vast majority of disease that we are seeing circulating in the community for respiratory viruses is really still going to be SARS-CoV-2 or COVID-19. Unfortunately, though, we have also seen the last couple weeks a significant rise in influenza illness and influenza diagnosis, not only locally in the community, but around the nation. So those two continue to be on the rise as far as what are the major viral pathogens around. Now, of course, we also know we do have RSV and the common cough and cold viruses as well. But I think really the vast majority is going to be COVID-19 and unfortunately with influenza on the overall rise as well.
So that's three different illnesses that you just touched on. What are the symptoms that people should be looking out for?
Yeah, it's really hard to tell what the symptoms are. I mean, certainly we know SARS-CoV-2 or COVID-19, that is going to be similar to regular cough and colds. You know, you may have some stuffiness, some sore throat, maybe some cough. You may have fever as well, but it's really hard to tell unless you actually get tested. The same thing for RSV. Influenza may be a little bit different. You may tend to have a little bit higher fever or temperature more often, as well as a significant body aches. But really for all these, it's very difficult to tell unless you actually go to a physician's office and get tested. Now, certainly we know that there are home tests for COVID-19. You can have symptoms, you can test negative, but we have to remember that you should be testing at least on 2 or 3 subsequent days for COVID-19 when using those home tests as well.
And I know you touched on testing there, again, taking a look at some file video that we do have here in the KCTV5 newsroom. Do you think that a lot of people are getting sick now because vaccinations are low? And I know we've been covering that for the past few weeks.
So I think those are two separate issues. I think we do know vaccine uptake is overall low, especially for the updated COVID-19 vaccine. But also really not where it should be for influenza vaccine as well. And we know people that are vaccinated against influenza, even if it's a year where the vaccine isn't a good match to the viruses, you have still protection and reduced risk of hospitalization and severe disease with influenza. And again, back to COVID-19, we know that those uptake numbers for the updated booster for COVID-19 are lower. It may help reduce infection in the short term, maybe for the first 2 to 4 weeks after vaccine. But really what we're looking at is that vaccine to get protection and reduce your risk of hospitalization in severe disease. So I think the main driver of why these infections are on the increase, it's really more about human behavior. It's about the cold weather. People have been getting together since Thanksgiving for parties and get-togethers, especially through the holidays, not spending as much time outdoors. And then, of course, that individual behavior of maybe not being and having adequate hand hygiene or frequent hand hygiene. And of course, we all know that we're putting our hands in our face multiple times a day without even realizing it. And so those are individual behaviors that will help increase the risk of getting infection and then, of course, getting ill as well.
And you just touched on it right there. I was going to ask you, post-holiday celebrations, people are now starting to travel back home, or they are back home, and children will start going back to school this week and next week. How do you think parents should take care of their children moving forward going into this new year? What do you suggest that they do in order to stay healthy?
Yeah, I think the first thing is if your children don't have the vaccines, again, most notably the updated COVID vaccine and influenza, there still is time. So talk with your pediatricians, get your children vaccinated. That will help reduce the risk overall of having severe disease from one of those illnesses. And even with the likes of COVID, may help reduce that risk of long COVID as well, especially for those young children. So we can do that, those preventive measures. Really try to emphasize, and I know it's hard for young people, it's hard for adults as well, really try to emphasize frequent hand washing. So maybe when they come in the house after being home from school, emphasize hand washing. Of course, when they're using the restroom, emphasize hand washing before they're eating, things like that. Those are very important things to do, and just understand, maybe where they may be going to parties or get-togethers with other people. But those are things that adults should be doing as well. So really, the preventive measures of being up to date with vaccine if you haven't been, and then of course really taking into account those situations that you may be going into, and of course adequate hand hygiene and hand washing.
And Dr. Hawkinson, before I let you go, when do you think that things will get better? Like I mentioned at the top of this live interview, that a lot of people are sick, not just here locally, but across the country right now, unfortunately. And it just happens to come right after those holiday celebrations. But when do you expect things will get a little bit better?
Yeah, just understanding typical respiratory viral season, I think we are now kind of getting into the throes of that. So those typical coldest months of the year, January, February, those months, right after the holidays when people have been getting together, they have been on traveling in airports, just like you said, we can see a lot of spread of the virus through that way. So I'm anticipating really another few weeks that we could still see our peak before we start to plateau. I would like to be wrong, and if we could see a plateau in our overall numbers of hospitalizations for COVID-19, for influenza and RSV sooner than that, that would be great. That would be great for everybody. But I think we have to expect that we are still just now getting into the main meat of the respiratory viral season. So it is vitally important to stay vigilant, do those preventive measures that we've talked about.
And doctor, is there anything else that you would like to touch on in this interview before I let you go here today?
I think that's about it. That's about it. Again, vaccination, if you haven't been updated with those new vaccines, there still is time. And of course, those adequate hand hygiene procedures and behaviors, trying to avoid touching your hands to your eyes, your nose, your mouth. It is always okay to wear a mask, and just understand those situations that you're going to be in if you're going to be around other people.
Again, taking care of yourself as well as your family. Dr. Hawkinson, thank you so much for joining me here at the live desk. If you joined this interview just a little bit late, no worries. It'll be posted on our social media platforms, and we will also have more coming up during our evening newscast. Thank you again, Dr. Hawkinson.
Okay.